don't know if you're going to have an issue. So that's why I always have fracture tests at the start. So of course you can do your bump test, which we did with our ankle, or your bump test. You can do your compression just right along the bone. And then the next one,
Is it the same as your squeeze test?
Yep, squeeze test, compression test. You're just stressing the bone to see if you get crepitus, okay? And especially like when you're looking fibular head, because that can cause that lateral pain and it would cause instability in our lateral collateral ligament. So you just kind of do that squeeze test, start distal, work up, no issues. Sometimes you can do a femur squeeze test, but usually what I do is just a log roll test, where we just rotate, because if you have a fracture in your femur, this will not be good at no matter what level, okay? So it's a really easy test to just be like, oh, okay. It also lets them relax, okay? So when you're dealing with knee injuries, similar to other injuries, but a lot with knee, you're gonna get guarding. So some of the tests that we'll go over are actually really not tests you can do in the field because the injury will be guarded too much. You won't get a good test. So sometimes just log rolling them will get them to relax enough, and then between tests you might need to go back to it to get them to unguard. Yeah?
Will that only help with like femur fractures?
Yep. So femur fractures, especially if it's like a neck fracture or even down low, you know, because if you have a femur fracture, a lot of times your big sign is that the leg will shorten, right? But if you have something like neck-wise or even socket-wise or just kind of down the line, just giving a little rock isn't a bad idea to just make sure we're not dealing with it, okay? So those are our two first big tests. Now we're going to go into Lachman's. So Lachman's is, if you have small hands, a very difficult test. So we're going to do 3 variations. We'll break apart, we'll try those 3 variations, and then we'll come back for the rest of the test. This is probably your best test for ACL, okay? And ACL is kind of out of your knee stuff, your biggest injury, because it's the longest return to play. So Lachman's, you want to come up to about 30 degrees, grasp right above the patella on the femur. I usually try to get my thumb near the tibial tuberosity, and then wrap my hand the whole rest of the way, okay? But if you have too small of a hand, what can happen is as you test, you're going to pull and rotate, okay? So you really need to make sure when you test, you're translating straight up, okay? If you're noticing you're rotating, then either you need to adjust hand placement to get more to the back to translate up, or you need to do an assist. So you need to bring them to 30 degrees. So you cannot have to hold the leg as much. You can use a bolster. I usually just use my own leg. You can roll up a towel, or you can use a sweatshirt or a backpack, whatever gets you to that nice 30 degrees. And then you can test a lot easier because now you're not trying to hold the leg up. You're just stabilizing the femur, okay? The other way you can test is you can have them flip over, scooch down so your knees are off the table. Need a stool. So this is the test I usually use for big football linemen or posts, because honestly, their legs are just too freaking big. So I usually just get really comfortable with feet, and I'll put it on my shoulder. However, you can do whatever you prefer, depending on your comfortability of a stinky foot by your face. So now, the table is now gonna stabilize the femur, so the table's gonna do all my work. The trick is you have to make sure you're translating correctly down, straight down with this test, okay? You need 30 degrees, so if you can't get to 30 degrees with sitting on a stool, you might need to kneel on the floor and then get to that level that you need to be at. This way you can grasp pretty much the whole width of your calf and translate down, okay? Does that make sense? All right, let's practice those 3 before we kind of move on to when you're stuck like holding on the field with cameras and you're like this. It just changes your angles a lot more. So I tend to prefer, especially when I worked men's basketball and I had bigger guys, I would never do Lachman's on field. I would do anterior drawer, posterior drawer, and call it good at that, and then do the Lachman's after I got them off the field, okay, or court. So anterior drawer, sure. Anterior drawer when you're on a table is really easy because you just sit on their foot. okay? You want about like little under 90 degrees. I'm sure there's a specific degree that the textbook wants. The trick is you just don't want them too high where you're not going to get a good opening of the drawer and the musculature is going to get in the way, or too low where you're not going to be able to get the foot flat. So usually what I say is whatever angle they can get their foot flat completely is about the angle you want. So you sit on their foot. I say sandwich with your 2 thumbs right onto the tibia tuberosity and then wrap around, almost like you're going to split the 2 gastroc bellies underneath, okay? And then all you do is you give them a little tug forward. That's your ACL. Then you give them a little push. That's your PCL, okay? You can get a false positive for ACL if they have a PCL tear. Does that make sense? So what happens is the PCL, if it's torn, will translate automatically the tibia backwards. So it will start in a backwards position from where it should be. So when you test the ACL, you go, oh, that's a lot more laxity, but I kind of get an infield. They must have torn their ACL. But really it's the PCL that's already translated them back. So that's why I say always do both of them in tandem to see what you have going on, okay? And it's a good little tug, and you stabilize the foot, okay? Then we get Slocum's anterior drawer and internal and exterior rotation. So Slocum's drawer is the same test. You just rotate them at the tibia, okay? Rotate them at the tibia so the foot kind of comes out for external rotation, and you test again. Internal rotation, test again. And then you can pair it with a posterior drawer as well. So you can go back and forward. And what you're looking for is you're looking for instability, because you're going to create more instability with the rotation, okay, for both your PCL and ACL, but you're also looking for any issues in your lateral compartments and your medial compartments.
So you want to do like a rotation of the foot?
Yes.
To test.
Yep, so you're trying to rotate the tibia to change the angle of the knee joint. So you're going to hit onto different parts of the knee capsule, okay? So if you're looking for laxity, that's ligament. If you're getting a weird rubbery feeling, that's usually something in the joint line, either meniscus or cartilage or an OCD or a loose body, okay, like a rubbery feeling. Most of the time, you're going to get like a blowout. So they're going to have another pairing with an MCL or ACL, and they're going to translate a lot more than they did with their PCL only or their ACL only. Does that make sense? Okay. So the next one we're going to do, so you have a few to practice, we're going to go into posterior sag and Goffrey's 90-90. So posterior sag would just be if this is lower. This is lower than this tibial tuberosity because we've lost the PCL and it's translating back. The next easy one from the same position is bring them 90-90, hold them. This is Goffrey sag, and you just look at tibial tuberosities to see if one's sagging or not sagging. Okay? And then valgus and varus. So a lot of people do valgus and varus free flowing up here, which you can practice, but I like a different way, so I'll show you both. So you can do your stress test for MCL at 0, and then come in and do your 0, and then you do your 30 stress test. Okay, what happens for me is I now have to hold this really stupid like large leg that I don't really enjoy holding up because it gets heavy, and then I also don't have the hip stabilized, so I tend to rotate in. Okay, so this for me is very difficult to get a good accurate valgus and varus to do it up here. So scooch towards me, so your bum is right there, good. So I actually drop them off the table. Now I'm using the table to stabilize their knee. So I only have to stabilize the outside. Now I can do 0. I can move around. 0, 30, and 30. And I can get a really accurate, really good test using the table. Okay? So I would highly recommend practicing both. I would prefer if you did the table version because it's a lot easier. But if you're a larger person and you don't mind holding the leg and you can get a really good accurate movement, then you're free to do that, okay? However, remember that you do need to practice this version because you're not going to have a table when you're on a basketball court, okay? So again, get decent at doing this way. Ooh, I'm so sorry. Do decent at this way, but really for accuracy, practice it with the table being the brace, okay? So let's practice those.